We'll discuss one of the most common MRCPCH clinical examination history scenario, cystic fibrosis. So first you have to take the history of onset, progress, and duration of this disease and how it has been diagnosed. Any aggravating factor like any infection, any relieving factor like any medication, any physiotherapy, and the associations. Cystic fibrosis is very commonly associated with asthma, nasal polyp, rectal prolapse, etc. Complications you may come across: growth failure, chronic lung disease, right heart failure, distal intestinal obstruction syndrome, diabetes, infertility, biliary cirrhosis, and sometimes may associated with psychological problem as well, and allergic bronchopulmonary aspergillosis, some metabolic disorders like any salt wasting, as well as any bone disorder. Important negative history you have to take related to respiratory symptom, any GI symptom, any CVS symptom. And how is the wee and poo? Because constipation could be a complication. Past medical history. History of similar illness like recurrent chest infection, any past surgical history because may be associated with distal intestinal obstruction syndrome. In earlier days, any past hospital admission, investigations, which is very important, any pre-flow test, pulmonary function test, what is the sputum results, any chest x-ray done recently, what is the blood culture results, or how is the inflammatory markers, CRP. Treatments. It's very important to judge the compliance and the side effect of the drugs and what are the medication given so far. Maybe the patient is on bronchodilator, DNase, nebulization antibiotic like colomycin, tobramycin, antibiotic prophylaxis like ciprofloxacin, multivitamins, steroids for allergic bronchopulmonary aspergillosis, pancreatic enzyme supplements, chest physio, any treatment of complications, or any portacath in situ or not. Consultants follow up. Basically, the treatment of cystic fibrosis is multidisciplinary approach. So, chest physician, general pediatrician, general practitioners to monitor the growth, physio, chest physio, dietitian to supplement the diet, high calorie diet, gastroenterologist to avoid GI symptom, cystic fibrosis nurse, psychiatrist to support the psychological problem associated, and occupational therapist. In birth history, it's very important to take the history of any meconium ileus or not. Immunization history is extremely important to take the history about pneumococcal vaccine or any winter vaccine like RSV. Nutritional history is very important to inquire for any high calorie diet or any diabetic diet. Development history, you have to take brief development history. Pubertal history is very important because of the growth failure, growth and development. Puberty could be delayed. Allergic history is very important because sometimes they are much more prone to have multiple allergies. Family history of similar illness, major illness, consanguineous marriage, and it's very important to ask 3 questions like flooring, how is there any pet at home, any indoor smoking, and you have to draw the family tree, and how is the family dynamics. Social history is immensely important because there are lots of social issues associated with the cystic fibrosis, and here lies the hidden agenda you may come across. Ask about the school. How is the academics? Is there any history of bully, loss of school days? How is the condition at home? Any education healthcare plan? Any social support the child is getting? How this affects the child's life and how this affects the family life. Thank you.